So today's topic is anti-inflammatory, antipyretic, and analgesic agents. And mostly we will talk about the non-steroidal anti-inflammatory agents, and this is the main group, and also about the drugs for the treatment of the gout and anti-rheumatoid drugs. So the most commonly used drugs for the treatment or for the treatment of the inflammation are non-steroidal anti-inflammatory drugs. So the name suggests the uh, effect of the drug, so they reduce inflammation. And this group includes the cyclooxygenase inhibitors, so they may be selective and non-selective. For example, aspirin is the most commonly used non-steroidal anti-inflammatory drug, and it is non-selective and also non-competitive inhibitor of the cyclooxygenase. And celecoxib is one of the first selective cyclooxygenase 2 inhibitors. And celecoxib Celebrex is the brand name of the celecoxib. Can be used to reduce the adverse effects of the NSAIDs. And there are a lot of other drugs that are in this group. So, and like ibuprofen is most commonly used NSAID after the aspirin, and ibuprofen and all other NSAIDs are competitive antagonists of for the cyclooxygenase 1 and 2. Some of them are more selective for the cyclooxygenase 2, others are less selective, and they are mostly used for the as antipyretics and analgesics, and also can be used to reduce the inflammation. Acetaminophen, or the brand is paracetamol in Europe, and Tylenol in USA. This drug has a different chemical structure, but still has the same mechanism of action. Also, the inhibitor of the cyclooxygenase, but acetaminophen has less anti-inflammatory action and is more antipyretic and has some analgesic properties as well. But analgesic is less effective than other things. Then there are drugs for the treatment of the rheumatoid arthritis, and rheumatoid arthritis is the disabling disease of the joints or bone joints, and usually leads to the pain in the bones and on extremities like legs mostly, and the drugs for the treatment of the rheumatoid arthritis include the disease modifying drugs like etanercept, for example, and also some antibodies like the adalimumab. So this is one of the first one, and also tocilizumab. So these are the new drugs that can be used to reduce the progression of the rheumatoid arthritis, but the disease cannot be completely cured, but only the progression can be decreased So these drugs will decrease the progression of the disease. And the last disease is gout. Gout is connected with the purine synthesis and the, some um, or some uh, some reactions can be disturbed with the purine synthesis that reduces the transcription and protein synthesis. So this one of the first drugs in this group is allopurinol and also probenecid. So this is a rare disease, usually hereditary, and uh, will only influence the purine synthesis. And we will start with the NSAIDs because this is one of the most commonly and used and most uh, effective groups in this list. And the mechanism of action of the NSAIDs is based on the inhibition of the cyclooxygenase. So these are the two types of the cyclooxygenase, cyclooxygenase 1 and cyclooxygenase 2. So cyclooxygenase is used for the oxygenase pathway of the arachidonic acid synthesis, and it will produce prostaglandins. So another pathway is a leukotriene synthesis. So like cyclooxygenase pathway will produce prostaglandins from the arachidonic acid that is can be taken from the membrane phospholipids. And there are two types of the cyclooxygenase, cyclooxygenase 1 and cyclooxygenase 2. And cyclooxygenase 1 is responsible for the production of the physiological prostaglandins that help in the that activate the that regulate the thrombocytes aggregation, protect the gastric wall with the mucosa, and regulate some physiological functions in the central nervous system. So that is why cyclooxygenase 1 is pretty common enzyme and can be seen in the central nervous system, in peripheral tissues, in the blood, and in the liver, in the stomach. So and cyclooxygenase 2 normally is only seen in the brain and the bones. So because it has some regulation properties in bones for the bone metastasis and for the functioning of the osteoclast, and in the brain also for the regulation of the neurons. But normally it's not seen in other tissues. But during the disease and inflammation, cyclooxygenase 2 will be activated in many tissues, and usually if the disease is systemic, in all the tissues, and that will lead to the inflammation. So cyclooxygenase 2 is producing the prostaglandins that will increase the inflammation, and that is why the selective cyclooxygenase 2 blockers like celecoxib, for example, will only block the cyclooxygenase 2 that is responsible for the inflammation, and will not block the cyclooxygenase 1 that is responsible for the physiologic functions, and sometimes the cyclooxygenase 1 blocking can lead to the development of a disease. So like for example an ulcer, when after the taking the non-selective cyclooxygenase inhibitors, so that is, for example, aspirin. Another pathway is a lipooxygenase pathway that will produce leukotrienes, and leukotrienes are the responsible for the inflammation, especially for the bronchial asthma development, and that is why the drugs that will reduce the leukotriene synthesis will like montelukast, tafirlukast, and xylitol. So these drugs are anti-leukotrienic drugs that will block the leukotriene receptor, or the uh, the enzyme, the lipooxygenase enzyme. So they will reduce the production of leukotrienes, or the can block the leukotriene receptors that are located in the tissues. So, and these drugs mostly used for the treatment of the asthmatic patients. So that is why we will not discuss these drugs today, because we already discussed that during previously. So that is why. So just to remind you that these are common pathways. And I will start with the aspirin, that is acetyl salicylic acid, and so the chemical formula is here. So like we have an acetyl group, and then the ether link, and then we have a salicylic acid that is actually the the aromatic acid. So, and the acetylic group is will react with the cyclooxygenase enzyme and will acetylate the cyclooxygenase. So, and that will lead to the inactivation of the cyclooxygenase. The product is a salicylic acid that is also has an anti-inflammatory action. So this salicylic acid will can be eliminated by the urine, or can further act as an active substance. So, but it is less active than the aspirin itself, or as a cyclooxygenase blocker, but has also some anti-inflammatory action, and also the the salicylic acid has also the antiseptic action as well. So and depending on the concentration, or depending on the plasma concentration of the salicylic acid, we can see the anti-inflammatory, analgesic, antipyretic actions. So these are the most common actions for the NSAIDs. And there are also anti-platelet action that is only seen in the aspirin, because aspirin is a non-competitive antagonist of the cyclooxygenase, and this is only seen for the aspirin, but other drugs will only have the analgesic, antipyretic, and anti-inflammatory action. So this is like in low concentrations, like 10 milligram per deciliter. So the dose for the tablet is like 500 milligram for the aspirin, and from 200 milligram for the ibuprofen. So the gastric bleeding and blood clotting and hypersensitivity reactions can be also seen as an adverse effect. So mostly gastric bleeding is reported by the patients. So this is the most common side effect for the aspirin and other NSAIDs. Then if we increase the concentration, plasma concentration up to 50 milligram, we have only anti-inflammatory action that can be increased. So the higher is the concentration, then the higher is the analgesic and anti-inflammatory action. And then at the doses of up from 50 to 100 milligram per deciliter, we will have toxic reactions like the tinnitus and also central hyperventilation that will increase the breath frequency. So and that will also lead to the uh, to the tachycardia, and can potentially be harmful for those patients with heart diseases like the congestive heart failure or uh, uh, the uh, uh, the um, ischemia of the heart and the stenocardia. So this and then if we further increase the dose, then severe intoxication can lead to the coma, the dehydration, and the uh, vasomotor collapse that will lead to the death. So the death is usually from the vasomotor collapse, and because of the coma, if there is no one around to help, and then the patient will die. So that is why the salicylates like aspirin and other NSAIDs are so the NSAIDs are prescription only in high doses. So like aspirin is OTC and ibuprofen 20 milligram is OTC, 400 milligram is prescription only. So because at high doses the lethal effect can be seen, and that is why it should be controlled by the physician. And aspirin additionally has a anti-platelet action, so it decreases the platelet aggregation and can be used at the low doses like from 50 to 325 milligram to decrease the platelet aggregation, and that will lead to the less cardiovascular effect of cardiovascular diseases like the thrombotic diseases, and that is why aspirin is used, because it is non-competitive inhibitor, and that is why it's highly effective for the thrombocytes that don't have uh, that don't have nucleus. So and that is why the thrombocytes cannot produce any new cyclooxygenase, and unless any new thrombocyte will be produced. So and all thrombocytes will die. The aspirin effect will last. So usually that about 2 weeks. That is the mean age, the mean life cycle of the thrombocyte. So thrombocyte actually cyclooxygenase will produce a prostaglandin H2, that is the thromboxane A2 that is released from the thrombocyte to increase the aggregation of the thrombocyte. Then the also prostaglandins will uh, will uh, uh, will influence the blood flow. So, and that is why diseases of the blood flow can be treated with NSAIDs, and usually prostaglandins, like uh, prostacyclin, like for example, prostacyclin uh, uh, can relax the smooth muscles of the vessels to make the blood flow better, and contra so the fight against the vasoconstriction. That is the reason for the diseases of the blood flow, like the vessel diseases. So and the indication, so the prostaglandins may decrease the synthesis of the prostaglandins that will lead to the uh, uh, to to that will lead to the vasoconstriction. So like because normally prostaglandins uh, protect from the vasoconstriction, and NSAIDs can inhibit synthesis of that prostaglandins. So and that can lead to the vasoconstriction. So vasoconstriction further can decrease uh, um, the blood flow to the organs, and that can lead to the diseases. So that is why the use of the saints is not recommended for the long periods of time, because that will restrict the blood flow to the different organs, including the heart, liver, and the kidney. And that is why the selective cyclooxygenase inhibitors are more uh, much safer. So because they only inhibit the cyclooxygenase 2 that is responsible for the inflammation. So like drugs like the celecoxib, diclofenac, meloxicam, and etodolac are selective, and also piroxicam in the less way, are more selective for the cyclooxygenase 2, especially at low doses. So with the dose increase, they will lose selectivity, but with the low doses, they are more selective for the cyclooxygenase 2. That is bad cyclooxygenase that will uh, produce inflammatory response. And that is why uh, these drugs will still have anti-inflammatory action, but they will not lead to the adverse effects uh, connected with the inhibition of the prostaglandin synthesis that are synthesized with the cyclooxygenase 1. So, and these uh, drugs like aspirin, ketoprofen, indomethacin, ibuprofen, and ketorolac are actually strong cyclooxygenase 1, so they non-selective, so they inhibit both cyclooxygenase 1 and cyclooxygenase 2, and that lead to the many adverse effects, including the uh, the GI bleeding, and the uh, blood flow diseases. So uh, but they are also more effective as an anti-inflammatory as well. So, for example, the ketorolac is one of the most effective analgesics among the NSAIDs, and can be prescribed. So for the same, for the analgesic effectiveness of ketorolac is close uh, to the opioid analgesics. So, but also the side effects are also higher than seen with other NSAIDs, like for example ibuprofen. So, but even ibuprofen in high doses can lead to the severe GI bleeding and ulcer development. And the same, so ketorolac is even more prone to that. So, and that is why there are so many NSAIDs, and every of them have some advantages and disadvantages. So here we can see all of them. So, like for example, if you look at the salicylate and the aspirin is most commonly used, and it is very inexpensive. So the most inexpensive and safe in the world, and it has a long history of the safety because it was produced in 1905. So and the company that is produced the aspirin is very well-known company, is Bayer, and started producing aspirin and sold it for the headache and the flu. So the aspirin was very popular and uh, is still the most popular uh, analgesic in the world. So and also it is the most consumed one because it is OTC. So then salicylic acid and its salts also can be used, but they are less popular. And then the diflunisal is without an antipyretic effect, but has less irritation of the GI. So then the next group is the acetic acid derivatives. So here we have a chemical classification. So these include the indomethacin, sulindac, and tolmetine. So these drugs are longer acting, and that is why it can be taken once or twice daily only. Like for example, aspirin will last like no more than 4 hours, but usually only 2 hours. So you have to take, if you have a headache and you take an aspirin, then your headache is not gone during 2 hours. Then like you have 2 hours to find out what was the reason for your headache, and then if you can't find out, then you have to take a second tablet, and then the third and fourth tablet. So it's long, to make it act long, and for the indomethacin, like, and especially you can take only twice daily, and sulindac and atometine, you can take one day or once day only. So these are long-acting derivatives. Then the propionic acid derivatives are less toxic and less effective than the salicylate, and that is why ibuprofen is the safest of the NSAIDs after the aspirin. So that is why ibuprofen is commonly used even uh, in children. So from the age of 6. So and then others like ketoprofen is more effective. Then naproxen is one of the safest. NSAIDs is naproxen. So and can be used in old patients. So and then phenoprofen, fluoribuprofen, ibuprofen, and oxaprozine. So these are the propionic acid derivatives. Have less side effects, less commonly side effects, so more safe, but in low doses only. Well, if you increase the dose, then side effects will also pop up. Then the next group is oxycams. We have two, meloxicam and piroxicam. So these are actually also long-acting derivatives. So not long-acting, let's say it. So and then we also have mefenamic acid and methylphenamic acid. So these are phenamates derivatives. And finally, we have a selective cyclooxygenase 2 inhibitors. So this is a celecoxib and also diclofenac, and these have also less GI adverse effects than aspirin because of the selectivity. But selectivity is also in low doses only, but they have higher adverse effects for the myocardial infarction and strokes. So because they block the uh, protective, the vessel relaxing factors, so that is why more strokes and myocardial infections. So these are advantages and disadvantages of the NSAIDs. And also we will speak about the acetaminophen or paracetamol in Europe and Tylenol in the USA. So acetaminophen has several metabolites, so it can be metabolized to the glucuronide, sulfate. It also can be metabolized to a toxic intermediate that is can be toxic for the liver. And it will in high doses when glutathione cannot anymore bind to this toxic intermediate, when the glutathione stocks will decrease, so then and it cannot anymore to make a capture uric acid from this toxic intermediate, then it will increase the toxic doses of this intermediate and lead to the cell death because of the hepatic protein destruction. So and that is why it's not recommended to prescribe more than 4 grams of acetaminophen per day. So like acetaminophen dose, tablet dose is 500 milligram, so that is 8 tablets per day. So it's not recommended to exceed this dose to prevent the toxic effect of the acetaminophen. Besides this, acetaminophen is the safest analgesic, and that is why it's commonly used in children, and the pediatricians like the acetaminophen very much. So, and they frequently prescribe that one. So that is all for today, and thank you for your attention. Also, if you have any questions or comments, then feel free to leave them below.